Welcome to VodTalk, and I hope you've all been well and keeping safe. And today, it's actually a great day, and actually the weather's been not bad. What is vaping? And can vaping lead to cancer? What health effects and implications are there? How do you know whether vaping has an adverse effect on you? These are only some of the things that we will be highlighting to get an insight on. And I have with me today joining two wonderful guests, and I would like to take you straight over to them. I have Jennifer Rahman, who is a health facilitator. And just briefly, I'd like to welcome Jennifer, and then we can go into finding out what it is that she does. So welcome to my show, Jennifer.
Oh, thank you for having me in. As you know, my name is Jennifer Rahman, and I'm a health facilitator, and that involves identifying people at risk of developing cancer. So what we do, once we identify them, we actually get them the right support by getting them cervical screening, bowel screening, and from there on, accessing the right services in NHS and then external charities. That's what we do.
Brilliant. Thank you very much. We will come back and find out a lot more. Before we do that, I'd like to take you all over to my next guest. His name is Mr. Sharif Islam, and he's a proprietor of, some of us will know of Feast and Mishti, based in East London. I have tried their food. It's actually, you know, very, what can I say, your authentic mother's cooking, and you know, you want to go there again and again. So, but we will talk about that later. But he's also an entrepreneur, and you know, he does. We don't want you on your head yet, Sharif. But I'd like to welcome Sharif Islam onto my show. So welcome.
Thank you for having me. As you mentioned, yes, I'm the proprietor of a Feast and Mishti, which is in Whitechapel, and yeah, authentic mother's hand shard is what we call. It's basically how we promote it, and it actually is, because some of the recipes are from my mum. So just to let the viewers know, so you can't get more authentic than that. I don't think.
Thank you for that. Well, let's hope you will have some of this delicious items for us maybe soon, you know. But, you know, today we will want to hear what your thoughts and views are on this topic of, can vaping lead to cancer? And what do we understand by the word vaping? You know, if I can actually start with Jennifer on this. Jennifer, can you actually give us a little insight, since you're from the health professional background, just what is vaping and what health effects and implications, you know, are there about this? You know, if we can try and find a little bit about what, you know, what is the understanding of vaping?
Vaping is basically it's like those little metal box, and it has a cigarette kind of thing, but you're actually smoking it. You're inhaling, steams are coming out of it, but you're not actually having a cigarette. So it's the next best thing basically compared to cigarettes, is to make you feel, because a lot of people think it has no nicotine in it, so it's easier to have it, and there's no harm in it. That's what they think. But the thing is, once there's so many informations there, but not everyone looks into it. And to be honest, nobody looks at the fine print, but it's there, and it tells, if you look into it and if you research it, e-cigarettes and vapings are like when you have an inhaler and if you're asthmatic and you're having an inhaler, which is a nebulizer. So when the medicine melts down, it breaks into a little mist and it starts going inside your lungs to go through your lungs to help you to breathe. So whereas with the e-cigarette, it's the same thing, but it has a little small kind of battery kind of thing inside it, and it has quite a lot of quite harmful chemicals in it. So it has diaclylide, which is a food additive.
Before we go into that depth of it, could you just tell us and the viewers, what is it that you actually do before, so that you know, they can get a bit of an idea of your background, and so if you can just tell us what it is that you do. What's your background?
My background is, as I mentioned earlier, we help patients. I work in quite a lot of boroughs, but my primary is Camden and Newham, and we actually go into GP surgeries. We help train them, other health facilitators. We train them also, and staffs in the GP practices to identify so they can get better health quickly and diagnose quite quickly, and they can identify the right stuffs. So my role is also looking at the health risk factors, what they're doing, and smoking is one of the factors that we found that is a major from that leads to cancer. So once we do that, we give them the right advices. As I mentioned earlier,
so screening is one of the major part of what it is.
It is, and cervical cancer and bowel cancer is one of the biggest ones.
I'll come back to that. Sharif, if you can tell us what your understanding is about vaping, what do you think it is? I mean, do you do it, or do you know of people who do it? You know, tell us about your thoughts about what your understanding is about vaping.
Okay, well, you know, a minimal understanding, I would say, but I'd just like to thank Jennifer for describing the actual device, if you want to call it, with a little thingy that sticks out. That's a very, very nice description. Yeah, so basically, from my understanding and from what I've been told, I don't vape, by the way, but I have friends that do, and it's more like it's more of a trend nowadays, more of a fashion kind of thing that everybody sticks out you know, a vape gun or a machine, whatever you want to call it, and a lot of females.
I think it looks like my pen, really. You know.
Yeah, the one part of it does.
Yeah,
the top part
and the
of
other
it.
part is
a packet of cigarettes.
Yeah, easily to get away with the pen. Yes.
Yeah, maybe a chrome part of the cigarette. But look, the thing is with vaping, the people who give themselves that hope of being in a more you know, better environment in terms of if they were to smoke a cigarette, they say that it's a little bit safer than smoking a cigarette. Also, the odor is not as much. So these are the things that I get from them. Look, you know, they say, you know what, Sharif, it's safer, so you're not going to get cancer and this, that. But nowadays, you know, science or the medical section, they're telling us otherwise. But these are the factors that they will mention. No noxious odors, for example, and also they say that you can have a control over the intake of nicotine. I don't know how much of it is true. Obviously, research needs to be done more, but I think it's more in fashion, and also it feeds the habit of a smoker. So that's how much you know, that's my knowledge on it.
Yeah. So going back to Jennifer on this, how much of it do you think you know, Sharif seems he's aware of vaping, and I mean, even
Not
for
much.
myself, you know, I mean, if there are people, I mean, I know people, friends who vape, and they make it. It's like they're justifying to themselves that, look, it's not as bad as smoking. It, you know, there are some that don't have nicotine, and they think they're safe, they're okay, they're not going to have any health implications. How true is that, Jennifer? You know,
it's not true, actually. If you look carefully, whereas when you had normal cigarettes, you can actually identify it takes a long process, and then it does affect. Whereas with vaping, it's like smoking 100 cigarettes a day. So that's how bad it is. I know they say, oh, it doesn't have this, it doesn't have that, but it is quite harmful. And it has quite 3 major substances in it that does actually make it quite bad. So what happens is when you do inhale it, what they don't realize, they think it's fine because there's nothing in there. And there's some food tasters in there, so camouflage is there to makes it quite nice and relaxing when you're having it. And what it
That's
does,
where all the flavors comes in.
Yeah.
That and that sweet smell. That
Exactly.
and then you think, isn't that the same? Would be as passive smoking if you were to.
Yeah, if you're sitting next to them, say if you have a friend or something like that, and you're sitting there, you are inhaling the same thing. And what happens in a long time, there's no, I think with cigarettes, you can see it. With vaping, you don't know how long it can damage, but it is quite quickly, it does. And what it does, it actually scars your lungs. It narrows down your passage as you inhale. So it affects quite a lot of things. And especially, I think nowadays, a lot of young people are now into it. As Sharif was saying, it's a fashionable item. It's like having a new iPhone, walking down there. And I think it's also to blend in with the society. And it's bad enough young kids are getting pressured in so many things.
Well, it's worrying, isn't it? It's worrying.
It is.
I mean, I was just saying earlier, before we started this, that my 15-year-old daughter, I just asked her, like, just out of the blue, like, do you know if kids in your school do vaping? Do you know what that is? And so the answer I got was, there are kids talking about other kids doing it, but they haven't got caught by the teachers or anything. And apparently it's a device that looks like a USB stick kind of thing. So it's getting more and more, you can just hide what it is that you're
the
doing.
sizes the sizes differ, don't they? So
they do.
From my knowledge, somebody's told me that the bigger it is, the intake of nicotine or the vape is obviously a bit more, and the smaller it is so that's how you control the smoke or the vape, whatever you want to call it.
Jennifer?
I'm not very familiar with this, but apparently
it's the same. It's the same. I know.
I've been getting a lot of wrong information.
Do you know what it is? It's people like our friends and everyone else. They're trying to make it seem it's okay. Like, I'm trying to give up my smoking, so I'm going to do this vaping to help me get off it. But does it really work like that? Jennifer, if I can ask
it doesn't. I think when you do try and explain the situation, how harmful it is, nobody wants to listen. Everyone goes, but it's safe. The NHS are giving it out. But and it is a business. So if you buy, you knowingly know I don't know how to explain it. I think, when somebody buys it and but you knowingly know what it's going to do or not, is you're up to. So later you can't turn around and say, oh, I didn't know this, I didn't know that. But do
you think that's addiction, doing that to them, that addiction has taken over, that, doesn't matter even, I mean, in cigarette packets, we see that horrible picture, don't we? Where I mean,
cancerous
I look at that.
Lungs and throats and all that,
It's really, really disturbing image, and I'm like, oh my God! Just looking at that, how would anyone want to buy that packet to even smoke? But it has to be some sort of addiction for them to go and spend. What is it? How much is it now? 14, 15
13 pounds.
I don't know.
I'm a very very social or infrequent smoker, if you like. So if I'll admit it here. If I buy a packet, it lasts me a few days, but I know the price. So that's the reason I know the price. Yeah. Right, but what I was gonna just say is, because since we're kind of learning about this, aren't we? And I think Jennifer's more of an expert than both of us here. But from a business angle, and what Jennifer just mentioned, it is a business. I'm just trying to think how they actually promoted this, because when they came out with this, I think there was something else before vaping. There was something else. I can't quite remember.
Is it a liquid kind of a
shisha,
thing?
wasn't it? From shisha to
shisha's the other thing. I mean, that's really in fashion nowadays, and people are making a lot.
Thing, though.
People are making a lot of money out of it. Yeah, I know the shisha bars and everything. But
so
I'm just thinking when they came out of I'm just thinking when they came out with it. Yeah. So when they came out with it, they must have promoted it in such a way that, vaping is the new smoking, without the intake, without the massive intake of nicotine and so forth. So I'm just thinking, well, how did they promote it? Because in the beginning, I knew that it was safer, and people started doing it because it was safer. It wasn't same as smoking cigarettes. But now we get to know that no, it's actually worse, as Jennifer has just mentioned. So this is my question is, or would be, how did they promote it in the beginning? And it must have been a deception, right?
Well, I'll tell
Because
you
it's
what
business.
I found out from research. Research is suggesting that, your cigarette is as harmful, your cigarette is harmful anyway with the nicotine in it, but that vaping, which some have, 5% of nicotine. And there's another thing that I found out called Juul pod. Apparently that is like a stick which the younger people are using, okay? And it is as much as having like a whole packet of cigarettes. I don't know what the kids know, but when it comes to that marketing, again, what I have discovered, I don't know, you were saying, how does it work on these young kids? It's all the fancy way of saying how there are flavors, colors, that's what the selling is. And, and research also suggests that, it's actually the bigger tobacco companies who are actually working side by side with these vaping, out there. So our kids are more at harm here. How do we go about that, Jennifer?
Well, have a conversation with your children, sit down, speak to them, tell them the dangers and the facts about it. I think it's also reminding. I know a lot of kids tend to argue back and say, "Oh, well, it's harmless." It's like, I know I had someone telling me about shisha, saying it's exactly the same thing, and shisha's not harmful, but it's exactly the same. So if most restaurants and clubs, what they do, they tend to do it inside, and you're not supposed to do it by law. If you're having a shisha, it has to be outside and it has to be an open way, so it's going. But the thing is, whether you're sitting closer or you're inside, you are inhaling it regardless of it. And once you're inhaling it, it does do the damage. And with the kids, I think they think, if I can't have the real...
When you say damage, what kind of damages are we talking about?
It narrows your lungs. It damages your the passage of and it also causes lung diseases, heart diseases. You can have quite a lot of cancer is quite a silent killer. It can start spreading so fast. It can start you can have skin cancer, throat cancer, because it's through the lungs. It does start affecting your throat. Right. But it does go straight to the lungs first, I have to say, because it's like a mist and it's going down. It's like little droplets. It's going there. So once it goes in there, it's starting to scar your lungs. And once that's scarred, there's no help really, and you're actually done, in other words. And I think for a child who does it, by the time they turn into adult, maybe in their 20s, when they're about 22, 23 or something like that, it is going to get worse for them. And I think for an adult, you kind of think, oh, I've lived my life, it's fine. The thing is, you're doing a long-term harm to yourselves. The horrible coughs, the chest pains, these are the factors.
Okay, so we find out that from actual cigarette smoking, there's that everyone, most of us are aware, the lung cancer. Can we say that vaping is actually working similarly towards that?
It is working towards that. I think with cigarettes, when you think about it, it's a long-term issue. The chemicals in it are not the same ones in the vaping, whereas with the vaping, has chemicals like diarrhea, which is a food additive. So it camouflages the flavors, and so when you're having vaping, you think it's fine, but it's more harmful. So when you're taking it, and also there's another one which is called formulate, which is a toxic chemical that can cause lung disease and also contribute to heart disease. And then the most worst one, once you hear it, it's actually quite scary. It's called acrolein. It's a weed killer. So that
sounds like acid or something.
Yeah, so it's a weed killer. So it's a chemical that straight away damages. So once you add all these three together, it's actually quite a potent chemical. So when you're having it, there's sometimes it depends on what companies are doing it. There's another one that's called THC. It's a chemical, but it's like a chemical in a marijuana. It can
Isn't that like a drug that young people are, you know, trying or using? You know, I mean, that name.
I wouldn't say it's just young people. There are adults who are using it too. But it is.
See, it's more worrying to know when the young kids are doing it. You know, adults. You know, they are responsible people, as far as I'm concerned. You know, I mean, I know Sharif is sitting there very quietly. Although he
I'm listening to you, ladies.
Although he doesn't vape, Sharif. Although you don't vape, you actually, even if you take the odd cigarette smoke, you know, are you hearing this professional, you know, facts that what you're doing to your lungs and also to our viewers, if you're planning to give up smoking and then think that vaping is going to help you, well, we have news for you. It doesn't work like that, does it, Jennifer?
No, it doesn't. Cigarettes, vaping, they're as harmless as each other. I think with vaping it's more quicker. And with cigarettes, it is longer, but it does do the same harm, but in a longer way. It does affect your skin, teeth, nails, mouth odors. So you name it, it goes. And I think you wouldn't like it. So, but it does. And overweightness. But it is one of the most major factors that does contribute to cancer, basically. Yeah. So that's one of the reasons we do a lot of presentations, awareness, just to let people know about it. And I think it's also communication barriers. Not everyone understands it. And so people with language barrier or who doesn't have much enough education. So if somebody tells them it's fine, they do take that. And I think having that in our community and places, when you highlight it and do focus groups and things like that, it actually helps others to understand. I think.
Sharif, have you tried giving up smoking?
I haven't actually, and it's because I never saw myself, I never saw myself as a smoker, a regular smoker. Some people, they see me, and they see me with a cigarette, and they say, "Oh, I didn't know you smoked," and it's because I don't. I let me tell you how I smoke. Every time I have a meal, or one of the meals that I have a day, and that's when I feel like having a smoke. Just after that, apart from that,
I am sure that's one kind of an addiction, isn't it? It's like the must-have, like the other strange thing I found out is apparently caffeine from teas and coffees are just as bad as the nicotine in the cigarette. So I'm not saying that justifies anything, but with the vaping and the actual tobacco cigarette, it sounds like there's similarities to that. So I mean, Sharif, when your friends do it, how does that make you feel? I mean, do you feel that, hold on, they're going to get less illnesses, by vaping than me? I mean, I thought that's how it was, but obviously it's not from what we found out researching. Yeah. So your friends, Sharif, I mean, how do they always, justify to say, hey, this is not as bad as smoking cigarettes? And do they know what it's actually doing inside them, their lungs, their brains,
I'm sure people are aware of all this. People do know, what poison they're taking. And this is what we say, what's your poison, right? So some people got alcohol as the poison. Some people would smoke a cigarette. Then you've got shisha, also vaping, and there are recreational drugs as well. Growing up in is sort of like Euston area and all that. You know, I've seen a lot of poisons. Let me just say. Now, you know what Jennifer mentioned earlier on marijuana. That's another one, and kids, you know, kids are on it. Now, if we want to tackle that, I mean, there was the old-fashioned way of tackling it. Like, for example, you know, I'll go back a good 30 years, and when my mum saw me smoking the first time, I was locked up in a room for a good few hours, and you know, that was one way of tackling it. And those things used to work because we used to be scared of the authority, which was our parents in those days. But nowadays that doesn't work anymore because we've moved on, haven't we?
Parents will get reported, won't they? For
yeah,
for such
we're more
acts.
educated. We're more educated. We're, you know, we're more enhanced in terms of, you know, how things work, and you got the local authorities to support you. So you can't do that anymore. So yes, it would be really wise to sit with your children, sit with your kids. I'm sure there is a legality here for who can actually vape and the age restrictions and so forth. But before that, because, you know, the thing is, we haven't got a big brother looking at us all the time. So kids do it when they're 13, 14 and everything. Sorry, can I just say, am I the only one with disturbance with the connection here, or are you guys having problems as well?
No.
What kind of connection problem? You seem to be fine.
It gets a bit, when you're going to be speaking to Jennifer, I'm going to put it on flight mode and I'm going to put it back on just so I can get a good connection. Is that all right?
That's fine. That's fine.
Okay.
You can do that now.
It seems to me.
Okay.
It seems to be okay now. It seems to be okay now. So let me just finish what I was saying.
Okay. Yeah.
All right, as long as you guys can hear me. Now, when you sit with your children, now this also depends on what kind of relationship you have with your kids. Do you understand? Sometimes people, you know, they don't have that kind of relationship, so kids, they don't want to listen to the parents. So first of all, I would say that you've got to be a good role model for your children. You know, do the be upright and do the right things, and then they follow you and they listen to you. With whatever problem it is. So everybody's scenario is different, isn't it? So if you think that, you know, I've got a good relationship with my kids, this is what we can do. We can sit down, we can talk, and then, you know, hopefully it helps. Other than that, if you don't have a good relationship, then there's people from outside sources to give advice to the children. But definitely it is about giving them the education and putting that knowledge in them, that what it could do in the future, how harmful it could be, and hopefully they don't go into smoking of any kind.
Yeah, that's very I mean, again, it's how much your kids, you know, value what you say, and sometimes we find, you know, for the adults, the parents, you know, need to be a little bit more streetwise to be able to relate to their kids, you know, because I do think, you know, it seems quite worrying that you know, kids are doing that, and it's because of, or, you know, the trend, like some of you were saying, and, you know, all the fancy flavors, and, you know, it's become like a social thing for them. And but the implications are, Jennifer, what I wanted to get to is a lot of it does have nicotine with the vaping, and it's just as toxic, you know, as the cigarettes, you know, smoke. And, you know, am I right to say that this can raise your blood pressures? It can increase like heart rates, and you know, and then you're going towards a heart attack and some form of lungs, you know, being affected in a lot of ways.
It does, actually. It also raises anxiety, breathlessness, tired, fatigue, quite a lot of problems it does. But like you said, it does raise all of these, high blood pressure. And if you already have pre-existing health condition, and on top of it, you're having it, it's going to get worse. And that's where you kind of wonder, have you gone, how far are you going to be willing to go, knowing that? I think some people don't know that, have the knowledge of all these ingredients in it. And I think it would be really nice to see people more, like you said, be more streetwise, more into it, more knowledgeable. And there's so many factors.
What are the long-term effects on this vaping? You know, we want to let our viewers know as well that, you know, how aware are you in your understanding of vaping, and, you know, the fact that from what we've gathered, you know, it can lead to cancer. You know, whether it's a slower process than, you know, smoking a cigarette. You know, whether it has, and again, like you mentioned, you know, even if it doesn't have nicotine in it, it's got these other substances and chemicals that is affecting the lungs, which in turn is going to, you know, take you closer towards having these, you know, stresses and anxieties, and, you know, and worse comes to worse, a heart attack.
Mm-hmm.
Yeah.
Yes. All of them factors do come into it, and it does affect that in the long term. And I think it actually damages your teeth. It makes your yellow teeth, your lips darker, your skin more tired, wrinkly.
Can't see any wrinkles on Sharif at the moment. I mean, he smokes, unless he's frozen there. I'm not sure. I think Sharif's frozen.
I think he's frozen. But
yeah, I think he's frozen.
Yeah, he's fine.
Okay. Yeah, you froze on us earlier. Okay.
No, well, what I did was what I did as Jennifer was speaking. I just put it on flight mode, and because I'm having a you know, little bit of a bad connection, I can see the bars are there. But anyway, disregard me.
What I wanted to say to you, Sharif, you know, have you tried? You know, I know you said you haven't tried stopping, but if you did try stopping, you know, how does that make you be and feel? And, you know, if you can share with us, you know, some of the experiences.
I think what it is I never thought of myself as a smoker, as I've said before, but I think I've seen people who tried to stop smoking, and they kind of, it's not an easy journey. It's actually it's a period of time that they've got to go through. And once they've reached the end of that period of time, you know, things start to get a little bit easier. But for people who stop smoking, you know, if they're regular smokers and they stop smoking, it's not easy. It is quite difficult, and there are other negative implications that could be put in, you know, place for those people for that period of time. For example, they'll put on weight. They'll be a bit more. You know, the mood swings kick in, and so I've seen all that. There's been times that I've actually handed somebody a cigarette, hey, have a cigarette and calm down, you know, that kind of thing. So your question, when it's you know, what would I have done? What would I have done?
How would it make you feel, so that, you know, we get to, like what you've said, that your friends have tried to, and these were some of the symptoms they were getting. I mean, we call them withdrawal symptoms, right, Jennifer?
Yeah.
You know, so it's these things that we need to look out for. Maybe Jennifer can tell us how it works, and how, you know, when is the worst time, you know, before someone can say, right, oh, I can't take it anymore, I need to go and have another puff or something like that. At what point in trying to give up, and these withdrawal symptoms are coming, you know, before they can go over that hurdle, what danger are we looking at?
Can I just can I just interrupt there for a bit? I just want to finish, because I just remembered something. I've seen somebody who stopped smoking for 2 weeks, and then they started smoking again because they couldn't take it. But I have actually stopped smoking completely at one point a good few years ago, and it didn't make me. It didn't make me feel anything because I wasn't, you know, a regular smoker. So yeah, remembering those times, and I remember I stopped in Ramadan, and after Ramadan, I just didn't pick up a cigarette for a good few years. I would say about 5 or 6 years. And I didn't, and I went on a sort of straight and narrow, if you like. a little bit. And for that, so I used to think the mindset was, no, I'm not going to touch a cigarette because maybe it's haram, it's self-harming and this, that, and the other. But then I went back onto it. I was going through a little stressful period, so I had a cigarette, and it calmed me down. And it does work. It does calm you down a little bit. But I think, I mean, there are other things that can calm you down. Other better routes. But yeah, so but for people who people who do smoke and they're regular smokers, it is quite difficult. It depends on the addiction as well. It depends on how long you've been smoking for and how much you're into it. You understand? I mean, we can talk about alcohol, and we know that alcohol becomes a part of your lifestyle, and there's a moment that people if they don't drink alcohol, then they're drunk. So it comes to a stage that they'll have to drink alcohol to be sober.
It's how much in control. Yeah, it's how much in control you can keep yourself. Yeah, going back to you, Jennifer. As I was mentioning, to what point can that person be encouraged or motivated to say, when you can do it? It's you've done it for 2 days. But they're getting irritated. They're getting all of those, anger, everything that you've mentioned. That all of those emotions kicking in, and how would they get encouraged and motivated to keep going? It's okay. This is the norm of trying to give up.
I think it's having someone reminding of that and what's the important thing and what the goal is, and also maybe having a buddy to help them, remind them of it. I think it's just promptness, praising you're doing well, it's fine, it doesn't matter. It's just one hurdle, you go after another one, don't worry about it. It's the reassurance, having that. And I think when you don't have it, and also making sure they're not in those environment where everyone's having it and you're not, it is quite hard. So just staying away from them, slowly easing. It's like being transiting back into school. It's like that, but it's just slowly. It's not going to happen overnight. It does take a while, and you kind of have to be patient about that. They're going to have mood swings. They're going to get upset, fidgety, annoying, because it's something. It's a habit. You need to have something in your hand or in your mouth. By not having, you don't know. So doing a lot of activities and things like that really helps.
The reason I'm saying that as well is I've got loved ones around me, family members, and they know who they are, and you sometimes even being the daughter, it's not enough for them to give up, and you try all sorts, and you say, no, you don't love me, Dad, you don't care, that's why you're carrying on. I mean, it just doesn't work, because the addiction is so deep, sometimes you think, gosh, am I going to break down and cry because I want my parent to live a little bit longer, what kind of things do I do? And there are other, loved ones who have had lung cancer, and are no more. And, when you think about these things, you just think, well, what does it take to motivate and encourage a person, to stop this vaping, which they think, is better because they're trying to get off the cigarette. But at the end of the day, what we have found out is it can lead to cancer. What will it take?
Honestly, I personally think if this person wants to actually change, they have to also accept it. Rather than forcing it, all it does is just drive them more mad, more bonkers, basically. So to do this, they have to also accept it. And it's like a therapy kind of, but the whole house has to actually, family, friends, they have to kind of go with it rather than expecting this person to do it themselves. And I think a lot of people don't realize it is quite exhausting. So when this person,
I've given up at the end of the day. I just, it's like that.
I think
I'm not coming to your house anymore. I'm boycotting. That's it. You're not going to see me again. And these threats haven't worked,
No, they won't work
they just
because
don't work.
No, like
Because,
Jennifer said, I think it's actually down to the individual. So first of all, you got to recognize that you have a problem.
yeah,
With anything else, actually, you just got to recognize you have a problem, and then you got to start with yourself, and then maybe ask other people around you to respect your feelings, because it's got to come from you. Nobody can help you, to be honest. So recognize the problem, and then you take those steps. I would
well,
say
it's addiction, isn't it? You've got
it is
to
an
think,
addiction. Yeah.
you've got to accept, hold on, if I'm not able to give up, you've got to accept it's some sort of addiction. And how do I go about it? So if you've got good friends, it seems like, you could do with that support, and, as Jennifer mentioned as well. But yeah, we're almost coming to the end of our show.
There's also hypnotism, by the way. Sorry, I just want to mention that that little thing
Hypnotism. Oh, has that worked
in
on
between.
someone then?
I know that there are therapies. Hypnotism is one of
Therapy,
them.
yeah.
There's hypnotism is one of them. Maybe Jennifer can enlighten us a little bit more in
Does
that.
that
I don't know
work?
about the
Jennifer?
hypnotism. I do know acupuncture, yoga, and also I think meditations and breathing. It does kind of help. So you're, like when you're having smoking, but everyone's rushing around. They don't realize they're breathing. They're taking in and out quickly. So with meditation, you're sitting down and you're taking in. It's the thing with yoga. So obviously it comes together. So it helps.
Maybe
Really
maybe hypnotism is the last resort. Just make you forget that you ever smoked.
Maybe
hate everything
works.
about it.
Yeah, maybe it works on some people, because I think everybody's addiction is a different level. I would have thought.
It's all right. I just thought I'd throw in a little joke there, just in case.
Yeah. No, do you know what?
Every little bit helps.
It might help. I don't know.
It could be a valid point. What I wanted to ask Jennifer quickly as well before we wrap up is, can you mention something to us about the screenings that you do as part of, your role in the health profession, and how can that play a positive part?
It actually plays a great deal, because once you realize, when we screen it, we actually read their habits, their health issues, and also are they smokers, and those kind of informations do help to identify, are they at risk, are they not, and by getting them the quicker, when you screen through all these information, it actually helps medical profession to identify a lot quicker and to give them the proper diagnosis, and also getting them screenings quite quickly, and therefore once they have that diagnosis, you can get them the service they need with in NHS and the external charities, and it does help. Like there's so, some councils are actually doing this, like focus groups, support groups, communities banding together, and those things do help. But cervical screenings and bowel cancer, it's not enough information is out there, and also it's the stigma and the taboo in the community. Nobody wants to do it, nobody wants to talk about it, especially in our Asian community. It is a huge taboo and stigma. Nobody wants to talk, and they go, no, I don't want to talk about this, it's it's embarrassing. I went to one of the talk shows, it was a presentation, we were speaking, and it was in a Bengali community center, and nobody wanted to talk about it. And I remember having
why do you think that, why do you think they
it's
just want to put it aside?
It's a taboo. They go, oh, why do I, it's a private bit, it's a private, I guess, the area. Why do we need to talk about it?
And this is even after having explained to them, some of the serious implications it can have on the health, and showing them that, look, there are people who are suffering and going through, these things, and you should stop while it's, while you can, before it gets too late. Maybe
there is one thing I have to say. I found female, I think in our Asian community, female ladies, I did find them really quite wanting to talk about it, and maybe not together as a group, but individually, and they were really quite responsive. Whereas with the men, it was really hard. And like, no,
Yeah.
there's nothing wrong with it. I'm fine. And you kind of think, no.
Do you think that's true, Sharif? Is that,
Yeah, no,
is
I
that
agree. I agree.
yeah?
I agree with Jennifer. Like I said before, you got to recognize the problem, and if you don't recognize, I mean, in the first instance, they don't even think it's a problem. So why do we need any help? Do you
Yeah.
understand? So
It's like
even with the,
attacking them,
even yeah,
masculinity, really. You're actually attacking
yeah,
them. That's what they
Yeah.
think.
yeah,
Mm-hmm.
yeah.
Okay, so to wrap up now, if we were to inform, whether it's our elders or the young people, if I can, just ask Jennifer first, and then if Sharif can give us some tips and ideas, maybe, because it is a serious thing here, and cancer is a big thing. It's not a joke, and to even self-educate oneself must take something. What tips and what information could you give to our viewers and people out there about this whole thing? I know we don't have, enough time here to cover as much as we would like to, but to give as much insight as possible, what tips would you give to people and information?
I would personally say speak to your kids. If you have a good relationship, like Sharif said, speak to your kids, it's good. And if you don't, try and get them to, I don't know, get research, find them, give them the notes, try and get them in contact with their local communities, go with them. If you can't talk to them, others could sit down and speak to them. There's so many groups there, and there's so youth clubs and things like that. Being in there and, mention that, and finding in your local community there's a focus groups going with there, that also helps. So for young people, it's just showing them what harm was. There's so much on YouTube's, Google's, if you search it, and it does tell you those things. And I think seeing what's harmful, and I think when you have someone celebrity who's gone through it and has had those health issues, it actually brings it down home. By not having that, they just think, oh, well, this person's having it, nothing's happened to them. But I think just doing a lot more research and also self-educating yourself. There's so many things that just because it's cool, it's not okay.
Well,
but
people, even for myself, if I know, like, oh my gosh, I'm getting certain symptoms, for example, I'm too scared to find out, and I delay it and I delay it. People may be out there in a similar situation where they're just too scared to look it up to say, this is what's happening to me now, and I'm at a late stage. So for that to be prevented, people need to start acting now, right?
Yeah, I think it's also making yourself more like we do a lot of presentations. We speak to, we had I think a lady came in. Nowadays, everyone looks up at Google's. Doctors are not like, they're not going to remember. Some doctors are quite busy, they're rushing. So you also have to educate yourself. So when you go in there, you know what the symptoms you're having, and then speak to them. Look, I've got this. Is it possible? Is it that or not? So having those information leaflets do help. I had a lady coming when I was doing a presentation, and she was telling me, I've got all these symptoms. Can you tell me, do I have cancer or not? Because we're not medically trained to tell them, yes, you have it. We go, no, you don't. But if you feel like that, you can actually go and speak to a GP, take the leaflet with you, show, you feel you've got those symptoms, if that's what you believe you have it. And if you're having those, and then it sometimes helps. Sometimes doctors will say no.
Sure.
It could maybe because this patient has been coming so many times, or because of the communications, and it's really quite hard. Nowadays, not everyone speaks English, and so having that barrier, it makes it quite difficult. So
sure.
The woman I was telling about, she came back actually, and she found out that she had 6 months left. So it was really quite upsetting. But she was saying if I didn't know, and if I didn't take the leaflets out and showed it, I wouldn't have known about it. So in some way, it gives you that, I don't know, satisfaction that you've actually helped someone and you're actually spreading the awareness. The more awareness you have, the more you have a chance to prevent from getting cancer.
It's simply just letting them know the facts of, what what's in this, item, and what damage it's actually going to cause our heart, lungs, and even the brain cells. So thank you for that, Jennifer. Sharif, if you'd like to,
I think you've covered. I think both of you covered most of it. Yeah. There's not much I can say, but again, I would probably
seeing people around yourself. I mean, like you said, what actually helps. I mean, we're talking about real people here. Real situations. Your surroundings, for example. It's real. This vaping actually can lead to cancer, and it's real. And how many people have woken up to think, hold on, I know I'm doing this for pleasure. I know I'm, enjoying this, but in the long run, what would you, how would you encourage?
Creating awareness? I mean, it's definitely creating awareness, and talk about it a bit more. People need to talk about it. Maybe there needs to be sort of, I don't know, we don't want to make it so big, but small seminars, maybe in departmental basis. Do you understand? So it depends on what who's working where, what college, university, whatever. Workshop as well. And the fear, it needs to create a fear, a realistic fear, and because it's there. Today we've learned that vaping is much worse than smoking a cigarette. I mean, look, if you look at it, anything unnatural, anything, and these chemicals, the body is not designed for these chemicals to enter the body. So these chemicals are for other uses. So for example, a weed killer, which you mentioned, which was quite frightening to me, to be honest. But this is not for this is to kill things. It's not for the body to intake. So if it goes into the body, then definitely it will create it will cause damage. So awareness needs to be there, and the fear has to be installed in someone, if you like, and it's not an easy task. But when people are scared of something, then they tend to stay away from it, maybe for a bit, until that the fear runs out or whatever. There's always something that takes over something else. But I think those two things, awareness and people need to be afraid of what the long term will involve.
Excellent. Yes, brilliant. Thank you very much for that, and thank you both for coming on my show. I know.
And then there's hypnotism again. Sorry to interrupt you. Hypnotism.
Yes, definitely.
I like that word.
Yes. I mean, there's so much more out there, but I think what we have found out is, there are dangers, and it's, the vaping is as, if not, as toxic as the cigarette as well, and, we to create awareness, like you're saying, it's be around those positive surroundings, and, we can only do our part in trying supporting people around us.
Absolutely.
But thank you again for coming on my show, and I do hope to see you both
You're
again.
welcome.
Thank you. You're welcome.
Thank you.
Bye. Take care.
Bye.
Thank you. Right. So, can vaping lead to cancer? Yes, it can, unfortunately, and it has its consequences. There are many withdrawal symptoms where, when people are trying to give up the smoking, they try to use vaping to help them come off it, but that's not the case. That is not a form which is recommended. So what we need to find out is what can help us try and stop all of whether it's the vaping or the smoking of other substances in other forms. Encouragement from your family, your friends, having a healthy diet, and possibly attending some workshops which help encourage you on a day-to-day, whether it's getting off the nicotine or the vaping, which is just as dangerous without the nicotine, which has some acid particles. Again, it can rupture and damage lungs, heart, and even some parts of the brain cells. This is what research, is showing us. And on that note, I do hope that you find what we have covered beneficial. Do take on board what our health professional has given us and the experiences from, our other guests. And, I do hope that you all keep well, keep safe. Do share VodTalk, get in touch with me for topics that you would like to bring on, and have a great day. Thank you for being with me.